Thank you all for being here. Thank you for doing that. My name is Naomi Hoffer, and I'm honored to be the program manager for the Sherry Sobrato-Brisson Brain Cancer Survivorship Program. And this webinar is an additional special issue of our regular monthly Living Well After Brain Cancer webinar series, which is part of a number of programs that we have in our survivorship program and a result of a generous donation from the Sherry Sobrato-Brisson Foundation. So I'm delighted to be here today. And I'm really pleased to have several esteemed members of our team at UCSF with us today. We have Alexa Greenstein. She is our nurse practitioner who also leads our monthly brain tumor support group. Jane Rabbitt is also with us, who is the nurse manager for the neuro-oncology clinic and oversees all the nursing functions of the clinic. And Rosemary Rossi is our clinical social worker at the UCSF Neuro-Oncology Clinic and provides care and support to both patients and caregivers. Thank you all for being on this panel. We will first hear from Dr. Suzanne Chang, who is a neuro-oncologist who specializes in the treatment of adult brain cancer and, among other many esteemed titles, is the director of the Sherry Sobrato-Brisson Brain Cancer Survivorship Program. It's an honor to have her here with us today.
Thank you so much, Naomi. I also wanted to thank everyone for joining us for this community gathering to learn about how COVID-19 responses is being done at UCSF and specifically in the Brain Tumor Center. And while you're dealing with a brain tumor, hearing about COVID must be very worrisome. And to avoid exposure and prevent infection, there are many changes that have affected the delivery of healthcare. But we want to make sure you know that your treating neuro-oncology team is here to ensure that your care is coordinated and that your treatment is streamlined to not only be as effective as possible, but to minimize exposure and to keep you and the team safe. So in this webinar, we will review the measures that we are taking to safeguard you, your caregivers, and our staff as we continue to support your surveillance, your treatment, as well as any clinical trial course that you may be on. We will also provide helpful tips on how to get the most out of your telehealth visits, and probably the most important, ways that you can take care of yourself at home through this pandemic. So this webinar is made possible by the generous support of the Sherry Sobrato-Brisson Brain Cancer Survivorship Program. And I would especially like to thank Naomi for coordinating the webinar on such short notice, less than 2 weeks, and the members of the neuro-oncology team for sharing their expertise and their time for preparing for the webinar. Please do not hesitate to use the question and answer feature to note any questions that you might have, and you can ask the panel for their input after their presentations. So with that, I'd like to introduce Alexa. I will turn this over to you to offer an overview of the current COVID situation and important measures we can take to protect ourselves and families. Thank you.
Thank you, Dr. Chang and Naomi, for the lovely introduction. And thank you to those who tuned in this evening or are listening to this recording at a later time. To start off tonight's webinar, we wanted to share a brief COVID-19 epidemiology update and discuss ways you can protect yourself and slow the spread of COVID-19. The first coronavirus case identified in the United States was on January 21st and has continued to spread since then. As of this morning, there have been over 1 million cases confirmed and 58,741 deaths. The number of confirmed cases is likely an underrepresentation of the actual amount of cases since a number of people are going untested and undiagnosed. On April 12th, the United States became the nation with the most cases and deaths globally. New York remains the epicenter of the epidemic, both in the United States and worldwide. California was the first state that reported its first COVID-19 case, yet it's faring much better than other states such as New York. This is likely in part to California's quick and proactive action to limit the spread of the virus by issuing a mandatory stay-at-home order on March 19th. As of this morning, the state of California has tested 677,608 people, and of those, 46,164 tested positive for COVID-19, and 1,864 have died. Here in San Francisco, there has been much fewer cases than we anticipated, with 1,468 confirmed COVID-19 cases and 23 deaths. San Francisco so far has been spared largely of the coronavirus. Last week, San Francisco increased its testing capacity to all symptomatic residents and essential healthcare workers, and this weekend launched a large testing project in the Mission District, which is one of the most affected neighborhoods in San Francisco. Like other healthcare organizations around the world, UCSF is actively monitoring and responding to the evolving outbreak. As of this morning, UCSF Health System has tested 6,221 patients, and of those, 171 tested positive for COVID-19. Currently, there are 14 confirmed COVID positive patients hospitalized, with 7 in the acute care and 7 in the ICU. There have been 64 hospitalized COVID patients to date. 44 have been discharged from the hospital and 2 have died. The number of cases has not overwhelmed our system yet, but UCSF is actively preparing and bracing for a potential surge. Later in this webinar, Jane Rabbitt will be reviewing UCSF's response to the coronavirus outbreak in more detail. Many states, including California, continue to implement shelter-in-place policies that encourage all residents to remain home except for trips for essential services to limit the spread of the coronavirus. Although California appears to be flattening the curve, we are not out of the woods yet. On Monday, Mayor London Breed extended the shelter-in-place order until the end of May. On April 14th, Governor Gavin Newsom unveiled 6 critical indicators California will consider when determining if and when the state can ease off social distancing measures. The 6 indicators are as follows: expand testing to track positive cases, isolate and support those who are positive or exposed to COVID-19, maintain efforts to protect vulnerable populations, ensure hospitals and health systems are set up for any possible surges with appropriate staffing and equipment, develop therapeutics to meet demand, support and collaborate with schools, businesses, and other community partners to develop guidelines to keep people safe from illness, and establish criteria to determine when to employ certain measures such as shelter-in-place if warranted. The governor did not provide a timetable for when shelter-in-place restrictions will be lifted, emphasizing the need to monitor the state's progress closely in order to guide any changes. So what can I do? As the COVID-19 pandemic rapidly evolves, there has been an onslaught of news, information, and rumors on the novel coronavirus. It could be difficult to know where to obtain reliable and up-to-date information. It is highly recommended that you equip yourself with information from credible and reputable sources such as the U.S. Center for Disease Control and Prevention and the World Health Organization. Your state and local public health department will also have updated information and resources. Currently, there is no vaccine or treatment to prevent coronavirus. The virus is thought to spread mainly from person-to-person contact, and the best way to prevent illness is to avoid being exposed to the virus. The U.S. Centers for Disease Control and Prevention recommends everyday actions to help prevent the spread of respiratory viruses, such as frequent hand washing. Wash your hands often with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer that contains at least 60% alcohol, as this will help kill germs that may be on your hands. Be sure to wash your hands when hands are visibly dirty, after handling animals or animal waste, after coughing or sneezing, before, during, and after eating, and after toilet use. Follow good respiratory hygiene. Cover your mouth and nose with a tissue or your bent elbow when you sneeze or cough. Throw your tissue away immediately after use and clean your hands. Clean and disinfect frequently touched surfaces. It may be possible that a person can get COVID-19 by touching a surface or object, like a doorknob, light switch, or package container that has the virus on it, and then subsequently touching your own mouth, nose, or eyes. Avoid touching your face. Touching your face can allow germs such as viruses enter into the body and cause an infection. Maintain social distancing. Stay home except for essential needs and activities. Consider talking to your doctor about getting medications delivered to you, or consider having food and supplies brought to your home by friends or family. If you are around other people outside, maintain a distance of 6 feet from others, which is about 2 arm lengths away. Respiratory infections like COVID-19 can spread through droplets in the air when an infected person coughs, sneezes, or talks near you. Staying 6 feet away from other people will decrease your contact risk. Wear a cloth face covering when in public. As of last week, San Francisco and 6 other Bay Area jurisdictions have made face coverings mandatory for everyone outside the home or outside a private vehicle, with the exception of exercising outdoors and children 12 years of age and younger, as there may be a benefit to reducing asymptomatic transmission of the virus. Cloth face coverings should not be placed on anyone who has trouble breathing, is unconscious, or unable to remove the face covering without assistance. Wearing a cloth face covering does not eliminate the need to physically distance yourself from others. Avoid contact with people, especially those who are sick with respiratory symptoms like fever and cough. The main features of this virus are fever, cough, shortness of breath, and fatigue. The U.S. Centers for Disease Control and Prevention have also identified other symptoms with the virus, such as loss of smell or taste, nausea, vomiting, chills, repeated shaking with chills, muscle pain, headache, and sore throat. Call your medical provider if you start to experience symptoms, and stay home if you're feeling unwell. Along with washing your hands, maintaining social distancing, and the other recommendations just shared, it's also important to think about your goals of care if you were ever to get sick with COVID-19. COVID-19 can range from mild symptoms to severe illness and death. If you were too ill to communicate your wishes, what type of care would you want, and who will make healthcare decisions for you? Your healthcare team wants to make sure they provide you the best care possible and the type of care you want. Given our current circumstances, it would be helpful to communicate your goals of care and any advanced directives to your treating physicians and healthcare team. Lastly, I wanted to share that UCSF has launched a worldwide citizen science study to help fight COVID-19. This is a study that will help UCSF researchers learn more about the novel coronavirus, which will help predict, prevent, and treat further COVID-19 infections. Anyone 18 years or older with or without COVID-19 symptoms or infection is eligible to join. You'll be asked to complete a survey and report your symptoms daily for 6 months. Everything is done remotely on your smartphone. If you're interested, you can text COVID to 41411 or download the Eureka Research app by tapping the link in the PowerPoint. If you have any questions or concerns about the study, please contact COVID-19 at eurekaplatform.org or call the UCSF Institutional Review Board. Now that we have gone over the current COVID-19 epidemiology and ways to prevent COVID-19, I'll turn it over to our next speaker, Jane Rabbitt, who will review UCSF's response to the coronavirus outbreak.
Thanks, Alexa, for all that great information on the COVID-19 and how we can all protect ourselves. Now, I would like to share with you the patient experience here at UCSF and what our neuro-oncology patients can expect during COVID-19. I think the most important thing I want you all to take home tonight is that it is safe to come to UCSF and the neuro-oncology clinic. UCSF and the neuro-oncology clinic have set up testing and screening to ensure your safety. UCSF has implemented a comprehensive screening system that ensures our patients do not come into contact with anyone displaying COVID-19 symptoms when visiting our clinic. All patients are screened for COVID-19 symptoms before entering any clinical building. And UCSF has set up a separate screening clinic for patients with potential COVID symptoms, and these patients are isolated while waiting for test results. And most recently, all surgical patients, regardless of symptoms, are being tested before being admitted. I thought it would be helpful for you to see what the main entrance into the ACC building where our clinic is located now looks like. Everyone entering the building is stopped and undergoes a global check-in. The global check-in is in all entrances of the hospital and clinic buildings like ACC. When you enter the building, you will go to one of those little kiosks, and the person there will review any recent flu histories, any symptoms that you've had in the last 28 hours up to the last 24 hours that you may be experiencing, and travel history. Once you clear those questions, you will be given a sticker showing that you're cleared, and we'll place that on your clothing. You will be given hand sanitizers and given a mask to wear. If you already have a mask, you either must replace it with a UCSF provided mask or wear the UCSF mask over years. There are some patients who come in with the N95 that have little filters, and it is completely not allowed to wear those filter masks while in UCSF space. This new entrance global check-in process will most likely continue through December 2020. I want to point out the website coronavirus.ucsf.edu. This is an excellent website with sections specifically for patients and specifically for patients with cancer. So I highly recommend you jotting that down and referencing that site. So what is the process for appointments in neuro-oncology? So if you're coming to neuro-oncology for an inpatient clinic visit, we have established standards allowing us to have patients here at UCSF. All patients will receive a pre-screening phone call the day before their visit. If they report positive symptoms, we immediately refer them to the UCSF COVID-19 hotline. If they are cleared, they'll be allowed to come to their appointment. If during the COVID hotline assessment, they are concerned about symptoms, then that COVID hotline staff will help our patients receive care. Once you come to UCSF, you will do the global check-in as I just described. You will see everyone in this building wearing facial masks. We have set up the policy of having one MD per day in our clinic to reduce potential of exposure. This impacts you because if you have an appointment on a Monday, but you're used to seeing a certain doctor, that doctor may not be in clinic on that day, and you will see one of their coworkers. UCSF has established a limited visitor policy, and currently there are no visitors allowed. However, we will request our patients to be allowed to bring one visitor to the clinic appointment in order to help navigate their appointments. In the hospital, they are much stricter, and basically there are no visitors allowed. We have also instituted high cleaning of all the equipment and rooms after each patient with disinfectant. Before I go on, I just want to highlight that clinic visits are always available if you're experiencing a change in symptoms or your doctor feels that it's best to see you in person. For example, it might be necessary to discuss a specific treatment decision, administer IV therapies, or when direct care assessment by your neuro-oncologist may prevent an emergency room visit. However, in the face of COVID-19, we have instituted video visits or telehealth. This has allowed us to continue to see all patients, even when not coming here physically to UCSF. Important things for you to think about when you're having a video visit is computer access. You must have reliable Wi-Fi, the MRI location in relationship to travel. Because if you have the MRI and then you need to travel home, you need to let the program coordinator for your doctor know that, so then they can set up the video visit based on that travel time. If the MRI is being done here at UCSF, there can be the option of coming up to our clinic to use one of our computers for the video visit. And then insurance coverage has been very important because it's allowed us to do these video visits. Medicare is now covering all video visits and allows for out-of-state patient visits as well. We are continuing to see new patients through our new patient referral process, through contact with our new patient nurse navigator, and now we are able to have video visits as an option versus only telephone consults that we previously were allowed. So supportive services are also available, but have moved to video visits or telephone calls. The Gordon Murray Caregiver Program has responded to the COVID-19 situation by being available by remote contact with the caregivers. This is especially important now that there is a restriction of visitors during patients' hospitalizations. The inpatient caregiver consultations that have been historically offered as a one-to-one consult with the caregiver or patient following the first brain surgery is now being offered as a telephone consultation with a video follow-up within 24 to 48 hours after surgery. Peer-to-peer caregiver telephone support remains an excellent option offered through our cancer center. The educational and supportive programming like this webinar have been transitioned to virtual options. The UCSF Brain Tumor Support Group and the Caregiver Support Group are now all offered virtually by Zoom once a month. And our medical social worker, Rosemary Rossi, who will be speaking tonight as well, continues to provide support to all our patients by phone consultation and/or video visits. When thinking about coming to the UCSF clinic, there are other areas that you might interact with, and I wanted to review a couple for you to let you know what they're doing in this COVID-19 situation. The MRI imaging facilities throughout UCSF have again set up strict protocol. They offer pre-screening phone calls to all patients. They have enacted physical distancing within the facility. They have hired additional staff for oversight of this physical distancing in their waiting rooms and their patients' changing areas. Again, you'll see that all staff and patients are required to wear masks, and the scanner rooms are disinfected following each patient, including the MRI tube, and they have added additional staff for this extra process. They've made scheduling adjustments to allow reduced number of patients in the waiting and patient changing room, as well as additional cleaning measures. So they've made it so that they'll go longer into the evening, and they're opening up starting in June, mid-June, Saturday MRI images. Another area that many of our patients visit while at UCSF is a radiation oncology department. Again, they have initiated pre-screening telephone calls and global check-in process. They absolutely allow no visitors during the treatment process, and their treatment rooms are disinfected following each patient. I think it is important to know that all treatment options, surgery, radiation therapy, chemotherapy, and clinical trials are available during COVID-19. There was a momentary slowdown at the onset of this situation, but the hospital and cancer center leadership understands that the care for our brain tumor patients is essential. When thinking about treatment options, one of the very most important options that UCSF Neuro-Oncology offer to our patient are clinical trials. There are two types of clinical trials, non-therapeutic and therapeutic. The non-therapeutic trials are those that don't involve actual treatment for brain tumors, but are possibly looking at research blood testing or quality of life questionnaires that would require you to come to UCSF. And all these types of studies are currently on hold. Therapeutic trials, those that provide treatment to the brain tumor patient, are open for accrual and enrollment. However, there have been some that have been put on pause during the COVID-19 situation. For example, trials that are first in patients or where the sponsor feels the risk or benefit ratio of the treatment is not safe in the light of COVID-19 situation. I want to conclude this portion of this webinar by having some general questions and answer session. We've had numerous patients ask some of these, and I want to highlight 2 of them. Many patients and caregivers have asked about whether they should delay their treatment, surgery, or radiation therapy here at UCSF Cancer Center. Decisions on whether or not to postpone cancer treatment need to be made on a patient-by-patient basis with your physician. If you are only having surveillance MRI imaging, it is often okay to push out your appointment up to 3 months. However, if you have any questions or concerns, please contact your physician's office. At this time, there is no evidence to support changing or withholding chemotherapy or immunotherapy in patients with cancer, withholding critical anti-cancer or immunosuppressive therapy is not currently recommended. Another question we've had is some patients have asked whether they are immunocompromised if their blood counts are normal and they are now off chemotherapy. Very few patients do not have their blood counts recover to normal post-treatment. It is in general, it is thought that you are no longer immunocompromised and not at greater risk for contacting COVID-19. I do want to point out a recent Chinese study of patients with cancer who had COVID-19 showed that patients who underwent chemotherapy or surgery in the past month had a higher risk of severe consequences of COVID-19 compared to those who had not received recent treatment. The risk appears to be higher in patients with more than one chronic medical condition. So that would be conditions like diabetes or respiratory problems. As the shelter in place has been extended through May, UCSF and specifically neuro-oncology realizes that it's essential for patients to have access to our clinic, and in the coming months, we will slowly increase the number of inpatient visits, realizing that we need to continue to provide physical distancing within our waiting room, allow for video visits with family members, and provide clinic appointment times that reflect changes in the MRI process, as well as our need to be able to disinfect our clinic rooms between each patient. Our take-home message today is your care is about you, and we are here to help you navigate this process. So next, I would like to ask Alexa to come back, and she is going to help us talk about video visits and how to make them the most productive for you.
Thank you, Jane, for that information. Now we'll be discussing telehealth and some best practices for video visits. As Jane nicely pointed out, the COVID-19 pandemic has forced a rapid restructure of how we deliver care. Telehealth has been extremely valuable and crucial to providing medical care during this unprecedented time. Telehealth is a general term for using technology to provide healthcare at a geographical distance. Telehealth encompasses a broad variety of technologies and tactics to deliver virtual medical, health, and education services. The main telehealth tool used by UCSF is video visits using Zoom, a video conferencing platform. Through Zoom video visits, UCSF providers are able to safely manage and serve patients remotely and have opened new channels for communication and collaboration with other remote healthcare professionals. In light of the COVID-19 pandemic, video visits are now offered to new patients regardless of payer or patient location, including across state lines. Previously, UCSF video calls could not be offered to Medicare patients who are not established at UCSF, and no visits could be conducted with patients outside of California. As Jane already mentioned, California law requires private insurers to treat video visits the same way they do in-person office visits. Your plan should reimburse a video visit as it would a regular visit. Copays and deductibles still apply. Our implementation of video visits through Zoom has been thoroughly assessed by our IT security team and has been specifically configured to meet the requirements imposed by HIPAA and the University of California. As a result, the security vulnerabilities that have been recently reported in the news do not apply to Zoom interactions between providers and patients at UCSF. Data for video visits remains encrypted and is not stored. Additionally, UCSF providers use the Zoom waiting room feature, which gives the provider explicit control over who's in their meeting. While video visits might be a good alternative to in-person appointments, there are many cases and situations that a video visit would not be a safe or viable option, as discussed by Jane. Emergencies are still emergencies. If you're experiencing a medical emergency, please call 911. And again, it may be necessary for your care and treatment to have an in-person appointment. Please talk with your healthcare provider to see whether or not a video visit is the best option for you. Now that video visits are becoming more mainstream at UCSF, we wanted to share some tips and best practice recommendations to assist you in preparing and making most of your video visits. Tip number 1, install and download any software you'll need in advance of your video visit. At UCSF, you'll need to download and install Zoom and have access to a MyChart account. Video conferencing can be done using a tablet, smartphone, laptop, or desktop computer. Any device with an integrated camera will work. Do not wait until the last minute to do this. It's very natural to have many questions and concerns when setting up your device for video visits. If you need help setting up or require help with MyChart or Zoom, please contact customer support. The contact information for customer support will be shared at the end of this presentation. Tip number 2, make sure the device software is up to date, as this will help improve the performance of your device. We also recommend installing an updated browser. Tip number 3, set up your devices ahead of time. Familiarize yourself with the technology and test your equipment and connection in advance. New technology can be very confusing. Devote some time to understanding how to log into MyChart and Zoom and learn its features. An example of a feature that you may want to learn about is the screen sharing option. This is a feature that allows you to share your screen, which can be helpful when exchanging images, for example, of a rash that may not be visible on the camera, and other information with your provider. Test out your camera and audio on your device before your visit. You could do this by the Test My Audio and Test My Video feature within Zoom. Tip number 4, find a location for your visit that is quiet, private, free of distractions, and has a strong internet connection. We often miss important details of a conversation when there's a lot of background noise and too many distractions around us. Find a place that will allow you to give your full attention to the visit. Keep background noise to a minimum by closing windows or doors nearby. Consider hanging a Do Not Disturb sign on the door to avoid interruptions from others. As with any medical appointment, you'll be sharing personal health information that you may want to keep private from those around you. Some may need to leave their home to go outside or to their vehicle to ensure their conversation remains private. That being said, video visits should not be done while driving or operating any heavy machinery. Having a solid internet connection is crucial of having a successful video visit. Before your appointment, test out your internet and find a location that has a strong and stable connection. If you're having trouble with your internet connection, try using a wired connection instead of Wi-Fi or moving closer to your router or modem. Tip number 5, when setting up your telehealth appointment, set your camera at eye level and pay attention to lighting and acoustics. Setting up your camera at eye level will make it easier for you to maintain eye contact and stay engaged during the visit. Lighting is really important for video visits. Healthcare providers can gain a lot of information from facial expressions, gestures, body language, and appearance. Inadequate lighting can make it difficult for your healthcare provider to see you. Soft, diffuse light sources in front of your face will ensure your face is free from shadows and glare. Avoid harsh lighting sources such as backlighting from windows, as this will create a shadow. Understanding where the microphone is located on your device is helpful to ensure your audio quality is good. When sitting too far away from the microphone, the audio is more susceptible to picking up room noise and echo. On the flip side, getting too close to the microphone can pick up unwanted sounds. Echoing and feedback during video visits is a common issue people encounter. Using a pair of headphones can help reduce echo and microphone cutout. Tip number 6, treat this like a normal in-person visit. Take some time beforehand to prepare for your appointment, as you might with an in-person visit. Write down any symptoms, especially any new or worsening neurological symptoms you're experiencing, and make a list of questions or concerns you want to address with your provider. This is a great way to ensure you get the most out of your visit. Be sure to have an up-to-date record of all your current medications, as your provider will want to review this with you. A video visit is much like an in-person visit. Much of the neurological exam that our providers complete can be done over video. Your provider may ask you to perform certain tasks, such as move your arms or ask you to walk to assess your neurological status. Therefore, it is recommended you dress as you normally would to see your provider. Family members and loved ones are welcome to join video visits. If you want to incorporate relatives or trusted friends to be a part of the visit, please let your provider's office know beforehand. Also, let your provider's office know if you're unable to make the time of your visit or need to cancel your appointment. Just like patients, healthcare providers may encounter technical difficulties, run behind in their schedule, or need to reschedule the appointment due to unforeseen circumstances. Make sure you're actively checking your email and phone for any appointment notifications from the provider's office. Here are a few tips to ensure your video session runs smoothly the day of your visit. Equipment. Make sure your device is fully charged or plugged in. While this is not necessary, this will help keep the battery from dying in the middle of your visit. Keep the camera at eye level and align your face in the middle of the camera. If your device does not have high quality speakers, or if you want more privacy, consider having headphones or using headphones or having a pair nearby. Location. Ensure the spot is private. Address noise from other people and animals in your space. Turn off potential noise distractions if possible. Close drapes or blinds to prevent glare. And remember to keep the primary light source in front of you, not behind you. Technology. Close any unnecessary programs. Having other things running on your device can strain the device's memory and reduce the quality of your video visit. A common issue many people encounter when joining a meeting is that their microphone is muted. Be sure to unmute your audio, your volume's on, and start your video. We want to make sure we could hear you and see you. Have some important information on hand. For example, the contact information for the provider's office and to MyChart customer service if you run into technical difficulties or need assistance. Remember to keep an updated list of your medications, a list of your symptoms, and any questions you want to ask. And keep material nearby to write down any important information or notes during your visit. Lastly, sign on a few minutes before your appointment to get settled and comfortable. You will be placed in the provider's waiting room until the provider is ready to admit you into the meeting. Here's a slide that contains some helpful video visit resources and the contact information for MyChart customer service. Now that we've reviewed telehealth and video visit best practices, we're going to change gears. I'm going to turn it over to Rosemary Rossi, who will guide us through ways we can take care of ourselves during COVID-19.
So sorry about that. I'm here tonight with you to talk about mental health in the time of COVID. So let me invite you to take a breath. Let's all take a few conscious breaths together. And I will too, because I got all discombobulated with the sound. Take a few conscious breaths and give yourself permission to feel. How are you feeling right now? Sense into your body. You may feel weary or grateful, anxious or hopeful, sad, lonely, or simply enjoying the solitude of sheltering in place. There are no wrong feelings, and no feeling is final. I'm sitting in New York, being a caregiver for my dad and working remotely. Lisa, a nurse on our team, sent me a delightful care package last week. And inside was a little book entitled, "It's Okay to Feel Things Deeply." The first page begins with, "You are not alone. Everyone gets emotional. We are all made of the same stuff." It is okay to feel things deeply, and you're not alone. These are unprecedented times. As patients and caregivers coping with a brain cancer diagnosis, your normal has already been challenged. And now this. Your doctor may have suggested that your cancer journey is more like a marathon than a sprint. And now this. Perhaps you feel as though you already have training in dealing with uncertainty. And now this. However it is for you during this global pandemic, one thing remains certain: emotions move. They come and they go. It's natural to have mixed feelings. Loss can live alongside laughter. One feeling doesn't cancel out the other. You may feel moments of joy and moments of dread, all in the same hour. You may feel numb to what's happening around the globe, or you may feel worried and helpless with too many things beyond your control. In these troubled times, it's harder to regulate our emotions. Noticing what we feel and naming it is a great step towards emotion regulation. Attending to our mental health with self-compassion and self-forgiveness is just as important as attending to our physical health. In fact, they're linked. And in the time of COVID, it's vital to focus on taking good care of our mental health. New York psychiatrist Sue Varma, the former medical director of the 9/11 Mental Health Task Force, says that during a time of high stress, it's more important than ever to focus on the 4 M's of mental health: mindfulness, mastery, movement, and meaningful connection. These are practical tips for everyone. They are small steps you can take every day as you travel on the road to resilience. The first M of mental health is mindfulness. What is mindfulness? Mindfulness simply means a moment-to-moment awareness of one's physical, mental, and emotional experiences without judgment. It's paying attention to the present moment, being right here, right now. Mindfulness practice has numerous benefits. We know from research that it can lower levels of anxiety, reduce emotional reactivity, decrease stress, help us cope with feelings of depression, help us manage physical pain, boost our well-being, and help build resilience. Experts say to start with just 10 minutes a day. There are many high-quality digital health apps like Headspace, Calm, and Insight Timer that can help you practice mindfulness. Or you can even practice mindfulness when doing a daily activity like washing the dishes, staying present to the sensation of the water, the soapy suds, the weight of the dish. Or you might choose to sit quietly and observe your surroundings without judgment. And when your mind wanders, which it will, begin again. Find a method that works for you and experiment with practicing mindfulness for just 10 minutes a day. Okay, the second M of mental health is mastery. Mastery is doing something you're good at or you're working towards that you care about. Anything that brings you a sense of accomplishment or joy or feels strengthening in some way. It could be a creative pursuit, but without imposing pressure or demanding perfection. It doesn't necessarily mean writing the great American novel. It could be something simple, like rearranging your closet. Small daily accomplishments can empower us. The third M of mental health is movement. Movement is good medicine. Movement is anything you are capable of doing, from rotating your ankles to running in place, taking a shower or taking the stairs, dancing wildly or tapping your foot to a favorite tune. Check out the free fitness and yoga classes offered online now. Incorporate movement into your daily life in a way that suits you, is safe, and feels doable. Hiking with my dog Cider is my favorite form of movement. Something to remember is that emotions live in the body. So moving our bodies can help shift our feelings. The fourth M of mental health is meaningful connection. Meaningful connection decreases isolation. We are wired to connect, but we all have different needs. If you think about a continuum with social connections on one end and solitude on the other, what level of engagement feels good for you? This can change from day to day, so it's helpful to check in with yourself periodically. During the time of COVID, you may be savoring the solitude. Maybe it's a relief not to have to go anywhere. On the other hand, you may miss socializing with your friends or chatting with the barista who made your latte every morning. Social distancing doesn't have to mean social disconnection. Sometimes using FaceTime can help fend off loneliness when we shelter in place. Keeping up with regular group meetings like a book club or a support group on Zoom can help us stay engaged. Continuing to celebrate life events, big and small, in new ways can add meaning to our days. Hearing the voices of loved ones over the phone can help soothe us during stressful times. Caring well for ourselves, our loved ones, and our pets can provide meaningful connection and give us a sense of purpose while adhering to stay-at-home orders. Monitor your news consumption and find ways to obtain reliable information without overloading your nervous system. Intentionally taking a break from news reports and social media can be an important way to connect with yourself and recharge your battery. As a person coping with brain cancer, you might feel like it's all you can handle right now, and that's completely understandable. And yet, reflecting on how all communities, in one way or another, are impacted by the coronavirus might inspire you to support others, despite your own struggles. Reaching out, even in small ways, can paradoxically help us feel more connected and more energized. During times like these, when everyone is coping with COVID-19, phoning an elderly neighbor, smiling from 6 feet away, or baking something and sharing it might help you feel better. Altruism is related to resilience. Mindfulness, mastery, movement, and meaningful connection. In addition to the 4 M's of mental health, here's a link for an excellent, evolving, living website from the UCSF Department of Psychiatry. We'll keep it up so you can copy that. In closing, especially now, I urge you to be extra kind to yourself. What you are dealing with is hard. While you may feel isolated because of your diagnosis or the diagnosis of a loved one, right at this very moment, humans everywhere are being threatened by COVID-19. We are all in this together. You're not alone. So again, I invite you to take a deep breath, and this time, gently close your eyes if it feels safe. Imagine that during this global pandemic, we are all on the road to resilience together. Every small step we take matters to ourselves and to each other. And meeting adversity along the way can make us stronger, remind us of our interconnectedness, and teach us what matters most in our lives. Thank you for your time and stay safe.
Thank you so much, Rosemary, and all of our panelists. Those were wonderful presentations, and I think there's a lot of great information in them. I want to remind you that we will be having this recorded. We are having this recorded, and we will be sending you a link via email, probably in the next week or so. So now I am going to take a look and see if we have any questions submitted, and if the panelists want to unmute themselves, I'm going to go ahead and read out a couple of the questions. One of them here, do you have any data you might share from any of the regions surrounding San Francisco? Not all of the Brain Tumor Center patients are in San Francisco County. So I don't know, Alexa, if you're able to answer this question regarding data from surrounding areas of San Francisco, do you know where we might be able to get that information?
Yes, of course. That's a really great question, and I'm glad someone asked that. So there's a lot of great resources that can be found online. One that comes into mind is the Johns Hopkins University. They have a dashboard that closely looks at each and every county and specifically identifies the rate of infections and the number of mortality and the mortality rate, as well as the hospital admission rate for your county. So that's something that we could definitely share with everyone tonight, is the link to that website.
Great. Okay. Thank you so much. That's great. And there's another question that came before. Jane, you may have touched on this a little bit in your presentation, but there's a question relating to any other, besides low blood count that might be a factor in those who have undergone brain tumor treatment, any other considerations that might make a person who has undergone brain cancer treatment more susceptible to obtaining the coronavirus?
That's a great question. When reviewing the data, especially the data here at UCSF, the main focus is on your immunocompromised status. So that if you are taking a drug that makes you immune compromised, like a chemotherapy or a biologic, then you are at greater risk to the effects of viruses like COVID-19.
It's here. All right. Someone has asked about ideas for exercise. Do we offer exercise counseling? And I can answer that. We do offer free exercise counseling for all UCSF cancer patients. It will be with Jane Clark, who is an exercise physiologist. We also do, for those of you who receive radiation treatment, we offer in-person exercise counseling during radiation appointments. That's on hold right now, of course, because of the COVID-19, but we will be stating that again as soon as we can. So for those of you getting radiation treatments here at UCSF, you will be able to connect with our other exercise counselor, which is Reagan Fedrick. When will UCSF reopen MRIs and CT scans for non-COVID patients? Jane, I think you might have already mentioned this, but do you want to jump in again in terms of responding to the question?
Sure.
Okay.
Can you repeat the question, please?
Sure, yes. It says you may have already covered this, but when will UCSF reopen MRIs and CT scans for non-COVID patients?
So the MRI imaging and CT imagings are open for all patients, and specifically brain tumor patients. We are not doing MRI imaging in the inpatient side, but all are outpatient locations. So the one in our building, the ACC building, the MRIs at China Basin, and some of the scans at Mission Bay are all open and accepting patients.
Okay, Great, thank you. And here's another question. Our son wants to visit us in May. He's coming from New York by way of Las Vegas and Los Angeles. He will be social distancing before he sees us. Do you think it will be safe to see him in 4 weeks after he leaves New York?
So one of the questions that they do ask on that global check-in here at UCSF is if you've been in contact with anybody that has lived in New York, specifically New York City, and they're looking usually for a 28-day window from that exposure.
Okay.
So that would probably be our best recommendation.
Okay, thank you. All right. Is there a qualitative assessment of being immunocompromised? From a quantitative standpoint, are there specific components of blood counts that are most relevant? Other measurements that distinguish someone as being immunocompromised. So Jane, I'll turn that to you as well.
These are all such great questions.
Yeah.
We look at the white blood cells and the components of those white blood cells to help us know whether a patient is immunocompromised. So when your blood counts are below normal on your white cells, and specifically your absolute neutrophil counts and your lymphocytes, then we would be able to help decide at what level of immune compromise you probably are.
Okay.
Great. Dr.
Just
Chang.
to add to that, yes, sorry. Just to add to that, Decadron or the steroid medications that a lot of our patients are on does have an immunosuppressive effect as well. It may not be reflected in the blood counts themselves, but it's also another factor that you want to keep in, be aware of. So any other medications that could just affect the functioning of the white cells as well is something that, for example, some of the biologics and so forth would be also factors to be concerned about.
Great.
I think elderly patients also have a less of a strong immune system. And so that's another factor to keep in mind. And we've seen that certainly with the COVID, where the elderly populations, not only because of their age and their immune status, but also the other abnormalities or other illnesses that they may have concurrently with being old, may put them at risk as well. So these are things to be aware of.
Great. Okay. All right, a question about the meditation. Rosemary, you had mentioned some meditation apps. Do you mind repeating those apps and any of your favorites that you would recommend if someone's going to get a meditation app?
Sure. Headspace, Calm, and the one that I use that I really like is called Insight Timer.
Okay.
And Insight Timer has many free meditations for sleep and all sorts of other things.
Great. Thank you. Okay. Another question about insurance coverage. Jane, again, you had mentioned this, I believe, but is there any extra additional charge or any less fee for a telehealth visit than for an in-person visit? Or is it exactly the same as their regular visits?
Yeah, so for video health, what both I and Alexa talked about is the major insurance companies and Medicare cover those at 100%, but patients still may have a deductible or a copay based on their insurance. Does that answer the question?
I believe so.
Okay.
Okay, and someone's also saying that UCLA has good mindfulness websites with a good mindfulness website with resources. That's good to know. Thank you so much. Okay, and another question from Tiffany. Thanks. When will UCSF roll out testing for everyone, not just with people showing symptoms? Is that in the works right now, or is there plans for that, for people to go in and get tested for COVID-19 at UCSF if they're not showing symptoms?
So currently, any patient that's going to be admitted to UCSF is being tested for COVID-19. regardless of whether they have symptoms. UCSF cannot test all people who call up and want to be tested. Currently, if you're a patient here at UCSF and you have symptoms that are concerning for COVID-19, that's the population that they're currently testing, and they do have hopes of expanding that.
Okay, great. And can you explain a little bit what the testing is like for people that are getting tested for COVID-19, and are the results immediate or delayed?
Well, interestingly, I've never been tested, but we just had a patient tested, and she found it to be quite uncomfortable because they take a swab in both sides of your nose, and that swab goes quite deep into your nasal cavity. And she said, absolutely, I would not want to have to do that again. But by doing it, she was tested negative and was able to proceed with her planned surgery. Suzanne, you might know better, but it's usually a next day result, but we have usually a 24-hour window to get the test results back.
Yes, that's correct. Certainly that window makes sense for patients who are planned to have surgery. I think, for example, at UCSF, they are working on more rapid testing, even a 5 to 15 minute turnaround. But all of those types of testing have to be really validated. So there's a lot of testing that makes sure, for example, that positive cases truly are positive and negative truly are negative, because the last thing we want is a test that doesn't give us the accuracy of information about the status of the patient. So, those are being tested on right now, especially as we think about what Governor Newsom has said, where availability of testing and understanding what the population exposure is like. As we move forward, though it's more global testing, I think that hopefully we'll have more efficient and accurate testing available as well.
Okay. Another question just came in here. Let's see, will brain cancer patients generally receive lower priority to receive a COVID-19 bed if there is a surge? That topic was raised during the surge in New York. So,
is the question that, am I understanding the question that if you have a brain tumor diagnosis and develop COVID-19, you would be potentially less likely to receive a bed within the UCSF system for treatment?
It seems to me like the question might be that brain cancer patients who don't have COVID-19, but just as part of their treatment or hospitalization, will they be kind of lower in priority? If there is a surge, will there be less beds, less priority given to the brain cancer treatment, brain cancer surgery and recovery in hospitals?
So we are so fortunate that the Bay Area did the shelter in place and did it early, and it has really flattened the curve, which has allowed UCSF and all the other hospitals in this area to really prepare for a potential surge in the future. We have a complete floor dedicated to taking care of COVID-19 patients, and they have been able to open up hospital beds in areas like Mount Zion, where they did not have any inpatients, to be able to take care of those patients so that our main hospital is open and able to take care of all other patients.
Great. Thank you. All right. I'm going to see if there's any more questions. We still have a couple minutes, but if there's not, I wanted to just move on to the next slide. Okay. Thanking you all so much for joining us. As I mentioned before, we're going to be sending you a link. This is going to be recorded. If you do have any more questions, feel free to just type it in now. We have a few more minutes, but if we don't get to it, we will respond to it in an email link that I'll be sending you very shortly after this. So in addition, I'd like to let you know that our next webinar will be on May 20th, and it will be on coping with fatigue. So we're really excited to be doing that one, same time, Wednesday at 5:30. And for those of you who would like to stay on with us, we're going to stop the recording now. We want to give you a chance to say hello face to face. I'll let you know how to do that. But for those of you who are leaving us now, I want to thank you so much for joining us. And once again, a thank you to all of my panelists for all the wonderful information that you provided. And we wish you well. We hope to see you again at a future webinar. Thank you so much for joining us.